All right, well, we're going to go ahead and begin. And so, good morning. Happy Thursday to everyone on this gloomy day in Kansas City. And if you're outside of Kansas City, hopefully it's some sunshine there. We are happy to have you all for our October Learning Community session. And our topic this month is health and education. And so, we're really excited to have two special guests, and I'll introduce them here shortly. Just some quick housekeeping rules. Please just make sure you keep yourself mute the whole time. And we will allow Q&A at the end of the presentation. So if you have any questions or any comments you would like to put in the chat box, please utilize the chat box at any time. I also want to give a shout out to our funders. So Community Mental Health Fund, Reach Healthcare Foundation, and Health Forward Foundation for funding our work here at Alive and Well Communities. And because of them, this work is possible. So thank you to them. And so I'm going to go ahead and just to make sure we utilize the full hour, go ahead and introduce our speakers for today. And so I have the honor of introducing Dr. Mary Esselman, who is the president and CEO of Operation Breakthrough. As CEO, Dr. Mary Esselman oversees an organization that provides education, healthcare, and social service each and every day to more than 700 Kansas City children and families. Mary has spent her whole career in urban education, working with a wide range of students from pre-K to 20 years of age in neighborhoods and schools in Washington, D.C., Chicago, Kansas City, and Detroit. Mary believes in using technology and innovation to bring gaps for children who are traditionally underserved. And now I also want to introduce Rachael Pedigo. I know I'm probably messing up. Sorry about that. She is the primary care clinic at Children's Mercy Hospital in Kansas City, and she also is now serving as the assistant manager nurse at Operation Breakthrough. And Rachel has developed a strong interest in utilization of data to drive change and growth. Celebrating 16 years with Children's Mercy Hospital, she has a passion to help performance gaps in healthcare and work to understand not only why they assist, but how to fix them. With her work at Children's Mercy, she is now working at Operation Breakthrough to help those barriers with families and children. So I will go ahead and turn it over to you guys. And Mary, if you don't mind starting and just giving a background of what Operation is all about and the services and stuff you guys do there.
Absolutely. So Operation Breakthrough is actually 53 years old. It was started by two nuns teaching on the east side of Kansas City. And some of the parents came and talked about the thing we really need is someone to watch our children while we're at work. And the sisters had this convent and they thought, you know what, we can do this. And so basically, they started out in the convent and using that space, and it went from 4 children to 40 to 400, and today it's over 700 children and families. It's a two-gen model in that we not only work with children, but we work with their families. And I think what makes it such a successful opportunity for children and families is that it integrates education, social services, and health. And so on site, we have the full Children's Mercy Clinic. We also have a dental clinic supported by Swope Health. We have behavioral health teams from child therapists to family therapists who are working with our littles, our teens, and then kind of a whole family. And then we also, every family has a social worker who's in family advocate. So we're really working on moving families forward. And so you don't pay anything to go here. Average income is about $12,000 per year. But the expectation is that you're in school, you're working, or you're working in that case management space to help move that family forward. So that's just kind of in a big nutshell. And then we obviously offer, when you think about building protective factors, we offer all those critical concrete supports, such as the pantry, clothing closet, emergency services, all those things that we know families need to provide that stable environment so kids can learn and thrive.
Thank you. So as we start the conversation, so just a little background of why we decided to have this conversation. Alive and Well recently merged with St. Louis Regional Health Commission, and we're doing this huge merger. And so we had an event last month called Just Health, and it actually was tied around this book. I don't know if you guys, I'm gonna take my background off real quick, if you can see the book. There we go. So last month we had the author from Diane, who was our guest speaker, and she spoke about just about the book and the racism and the issues, the barriers that our communities face around the healthcare world. And one of the parts of the book was about education. And so my question to you, Mary, is just talk about the issues about our families and our kids as they enter the child care, how their struggle with their health and how that might impact their behavior or their work as they enter child care without having proper health care services in their families and things like that. So
Mhm. So one of the things we see readily, and we're so fortunate to have the Children's Mercy Clinic here, is many of the children have not had all of those early preventative health. So whether it's well child checks, it's their immunizations, or it's just building a culture of health in the family. I use an example of oftentimes the health habits of our adults shape the health habits of children. And so, if we have families that have no access to health care or dental care or any health, oftentimes we're seeing those routines that will repeat themselves with children. So, rather than having that relationship with the doctor from birth and a clinic or the hospital, it's typically using the emergency room for health situations only when it's absolutely critical from a treatment perspective. And I think what happens in early care and education is if we look at that whole child, so we're looking at not only meeting all of those health milestones and then looking at the holistic development. So we're obviously looking at, physical health, but then we're also looking at social emotional competence. We're looking at early attachment. We're looking at all of those things that shape a child that go through those early years because that can make a huge difference. We had the Children's Mercy residents here last week, and they changed their rotation at Operation Breakthrough. And one of the things they do is the brain architecture game while they're here, because what that does is it takes all that brain science, for example, that pulls in your health and wellness, and it helps you understand that who and where we're born is that it's just basically a roll of the dice, but what happens to us in those early years, whether it's in health perspective and education perspective, determines what could otherwise be toxic and how it can become tolerable. And so I think that's part of that whole early learning space, is to make sure that we're putting in all of those supports that ensure that kids meet those developmental milestones, they enter school ready, which can be a huge predictor for long-term health.
thank you. So you mentioned Children's Mercy Hospital. So can you talk about how that collaboration began, how that started? What did that work look like? Maybe the beginning process of that. So if you want to go ahead and just kind of talk about that, and then I can turn it over to Rachel if she wants to kind of give her input.
Mm-hmm. Well, several decades worth of Children's Mercy, but when our founders were here, they used to just have an office space, and and Sister Berta would try to kind of figure out if there was a health issue or not.
Uh-oh, Mary, I think you are muted.
Oh, sorry, I
Okay.
bumped my button. But what was amazing is what started with just a nurse in a classroom, in a in a what is now an office space, turned into a full clinic in our expansion. Goodness, it'll be 20 years pretty soon. But the difference that made in terms of being able to actually create a partnership so that everything we do is relationship based, and we know that people don't talk to people they don't like, and they're not going to share all those fundamental things that you really need to know if you're going to be able to proactively work with families. And so having that there, you'd be amazed at all of the things that we're able to do, not only just from a physical health, but in terms of working with families. We just had a conversation this week on the fact that, the telehealth program that they have instituted with our families, most of our families can't leave work. And so, they're going to miss appointments if it means my job or my appointment job is going to usually come first. So the way that the clinic is able to look at the whole family in terms of what does that family need to thrive. And so Dr. Halleck does such a great job of, sending a letter or a note to the employer so that they know the parent is going to have to step aside just for a few minutes at work. So we can just have our school nurse or someone bring the child into the clinic, stay there, and make sure all those healthy things are happening. The other big thing about the partnership that I love is our partnership of resilient families. And so that is a partnership in which everyone from the leaders of the hospital to all of our direct service providers get together on a quarterly basis to really talk about the issues that our kids are facing. Whether one month we focused one quarter on the impact of lead and the impact of low income rentals and what that does to health equity for our kids. So we're able to kind of look at those and see what happens. The other partnership that I think is pretty amazing is the Community Action Board, which works with not only our families, but also medical personnel from the hospital as well as others in the community to really look at how can we impact research on the critical issues that face our families. And the definition that they did for toxic stress, it's been a minute, is still, actively used, which translates what could be considered kind of medical jargon into something that an actual parent understands of how toxic stress impacts them in their daily life. So the school nurse makes about 2,600 visits in a year. And think about what that means. If they're able to go into a classroom, build relationships with children and teachers, that keeps children here and it keeps parents working. And it also makes sure that they're getting the care that they need. So there's just so many ways that a partnership between a hospital, a clinic, and in early care and education can really create that culture of health that is oftentimes missing for our under-resourced families.
Thanks for sharing that. And so I'm going to turn over to Rachel because I know you're the manager, the clinic nurse manager. And so can you talk about maybe what you see, especially with new kids that you work with in the clinic and how that looks maybe day to day with working with the kids and the families?
Yeah, so thank you for letting me speak. And I will share a little bit of my piece. And then Dr. Halleck is actually here. She is the medical director over the clinic. And so she is able to leave clinic for a little bit. So I'd like her to be able to share some as well, you guys to get to know her. So I've been at Children's Mercy for a little over 16 years now, but I have only been over this clinic for the last, I don't know, a little over a year. And so I have learned a ton. And I've worked with a lot of doctors. I've worked with a lot of ancillary providers. And I will tell you, and going to Mary's point, the relationship building is in this clinic is something I have never seen in my career. The relationships that are built with the families, not only the families, but the children on the provider level, but also the nursing level as well, is just unrecognizable. And I think it is one of the most unique things about this, about the fact that we have a clinic in this daycare. So we have a clinic nurse that is staffed every single day with the provider, and they will see patients like you would in a normal primary care clinic. But something that is unique, we also have a Children's Mercy nurse that is staffed as the school nurse. And so we work very close together, and the school nurse is here every single day, and they are interchangeable. So the clinic nurse will rotate out to be the school nurse and vice versa. So we have somebody here almost the entirety that the daycare is open. And so something that is unique is if the classroom notices that a child is not feeling well, may have a fever, may have a cough, or their asthma is flaring up. We have a lot of kiddos that have respiratory issues related to asthma. And so the school nurse will be notified and they can go see those children in class, do a quick assessment. And if it's necessary, we have the ability to do what we call a pull from class. And this is something, again, that's very unique to our operation here. We can pull them from class, squeeze them in the schedule, and the provider can see them. If it's dire enough, we can see them within minutes. If it's something that can wait, we can schedule them when we've got the availability. But 9 times out of 10, the parents do not need to come on site for this. We can pull them from class, give the parent a call, say, hey, this is what's going on. Are you okay if we see them? Get permission, bring the kiddo in and do an assessment and go from there and determine what we need to do. Then we'll call families back and let them, hey, everything's okay. This is what we found. We're going to prescribe this medicine. We're going to go ahead and pull it from our med station and administer it here and send them back to class if that's possible. Or no, they probably do need to actually go home because what they have is infectious, or they're just not feeling well enough to continue on with school. And that's just adding another layer of access that families don't have to, like Mary said, parents not having to leave work is a big bonus for us being here because they just don't have the flexibility to do that. So our nurses, and we also have what we call a care assistant, and that's essentially like an aide that helps check the kiddos in and get their vital signs and measurements. And they also have strong relationships with these kiddos. Audrey is her name. She will go get the kiddos from class. She knows it's a very big daycare. So learning the lay of the land is a big challenge at first, but we've taught Audrey well. And so she goes and helps out to get kids pulled from class and bring them on. And we have a big goodie bag of treats that we get, not treats by snacks, but treats by little stuffed animals the hospital will donate over here and send our way. So the kids never leave here without something. To take back with them for their time being here with us in clinic. And I'll tell you, we have one little guy, is a frequent flyer of ours. He's got a little bit of what you'd say more complex medical needs. And so he requires some of our one-on-one attention every once in a while. He will intentionally do something ornery so he can come visit us in clinic because he loves the nursing staff. He loves seeing Dr. Halleck and Dr. Hubbard. So it's his little break from the classroom. And so the kids do, most of the time they really enjoy being in clinic with us, which a lot of children don't enjoy going to the doctor's office. So I will just speak to that relationship building that has happened that I have witnessed is just something that is incredible.
Thanks for sharing that. I mean, just hearing that and knowing that a lot of kids are scared to go to doctors when they're with their parents. So to know that their parents are not there and they're comfortable going to the clinic, and like you said, the little boy just sometimes want to get in trouble just to go. That is a huge thing. And so thanks for sharing that. And so and I think you said there was another nurse on call if she wants to speak.
Yeah, Dr. Halleck is right here. Her pop in.
Hi, I'm Dr. Halleck. I'm the pediatrician here and the director of the clinic. And what I love is being able to take advantage and really optimize the relationship here. You know, children and families come to Operation Breakthrough because it's a place where they feel safe and they get their needs met. And to also have their health needs met here is really amazing. And to be a part of a program that really works at not just addressing the current generation of toxic stress, but breaking the intergenerational cycle is just really amazing. And I think what Operation Breakthrough does best is allow us to meet the families literally and figuratively where they are to meet these needs so that we can help them really thrive using healing and connection. So helping them have new relationships with the healthcare system that are healing as opposed to, lack of trust, and just showing up consistently and letting them know. We realize that the families, it's not that they don't want to be healthy and they don't want their kids to be healthy. They just have so many barriers. And Mary's done a great job at letting us know what those barriers are. You know, the moms and dads, they can't leave work. So how can we get them what they need without them leaving work? And so having a partnership with a group that knows exactly what their families needs makes it really easy to meet that need because we just know what we need to do. So I came here to Children's Mercy to work at Operation Breakthrough just because this is where the kids are, this is where the families are, and this is where their needs get met.
Well, and I think
You.
the other thing that's I think is really important is our ability in the partnership to navigate some of the challenges that health has in general. So this past year, one of the other topics we've been exploring is medical home, for example. So that's it. That's a system that's intended to benefit, in particular, under-resourced families. Well, now here you've got 450 families. How does it work? And then how does it need to be adjusted? And so I think that's another thing that's really unique is we're able to not only try to navigate those things through the lens of a hospital and the lens of a community provider. And then we're also, because there's those trusted relationships, and you mentioned kind of asthma as a big area, we're also able to work hand in hand to help also increase our ability to understand asthma and other things through research. So I do think there's also other benefits from the direct service that come through having a partnership between a hospital and an early care and education center.
Thank you for sharing that. And I think you were going to kind of tie into my next question as you guys, I mean, this is awesome. You have a clinic in-house. Parents are able to work, continue to work. You don't have to worry about telling the kids and parents to go and get your services at a primary care doctor, and the issue might be transportation. So what are some other barriers that you guys maybe have noticed as you're doing this work? And then also maybe some challenges as you have this partnership. What are maybe some challenges or improvements you guys have looked at and to make it either a better process or to add more partnerships or collaborations?
I think a great
Anyone?
example might be in 2018 when we did a pretty big expansion across the street and bridged our buildings. You know, one that was a point too at which there was a lot of change going on at the hospital, and obviously you have to have a clinic that is, you know, it can't be a total drain on resources. And so one of the things was happening is when kids were coming in and out of the clinic, there's not a lot, there's only 3 exam, I think it's still 3, isn't it? 3 exam, now we have to 4. Yeah, we got to convert one during that process. But we needed to make sure that the clinic could also see individuals from the public. So they were able to, through just seeing the experience of how does that work when kids go in and kids go out, so they're not maintaining, you know, staying in an exam room for an overly
Mhm.
long time, we were able to add more of a nursing, a separate nursing, you know, room. I think we've been able to evolve based on not only the needs of the children there, but making it also a full service clinic for the community. I think that's one of the things I've loved to see evolve, and then kind of figure out how do those nurse rounds work. And there was a period of time we don't have to do it as much, but the COVID is another example in terms of COVID. Having a provider there allowed us to stay open through the entire thing. And I don't know that that would have been possible had we not had that partnership, to be able to, if someone was symptomatic, be able to test and kind of make sure we're doing the correct isolations or whatever. So I think those are 2 examples for me that show some of the challenges we've gone through, but our ability to take what we learn and continue to kind of be innovative and progressive in how services are delivered.
Thank you for sharing that. And so I like to end on a positive note. And so this is amazing news. Can we talk about how families are reacting to this? Just maybe some words how they've come to you all and just express their gratitude for having this service directly at the child care center. Do you mind speaking about that? Maybe giving some examples. I just really love to hear, especially like the little boy, but also how are the families reacting to this? And maybe is that keeping kids at the child care center, retention, I guess with staff, is that keeping staff at the child care center with the relationship building? If you just mind speaking on that.
Rachel, do you or
Yeah,
start?
I would say a lot of the nursing in general is a pretty thankless job.
Yes.
I would tell you that a good majority of the families that we serve here, if the families are having to come in, especially if it's for an unexpected visit, they're often in a crisis state, or they're very, very stressed out. So having to deal with a sick child is something that is adding a layer of stress in their life that they may be completely over capacity and are not in the headspace where they are able to really truly think through, like, this is actually a good thing that we're here doing this. So yes, we see families that come in and they're very grateful and chit chat with us and all of that. But a lot of times we see families that they're at their absolute worst because of the circumstances that they're facing. Because these families are very underprivileged. They do not have working transportation. They oftentimes don't have, their light bills are not paid, or they don't have food on their table. Their kids don't have the shoes or the clothes or the things that they need. So they're dealing with a ton of stress. So the interactions that we have sometimes are purely just letting them cry to us, letting them vent to us, coming to us, knowing that we're a safe place for them to feel heard and validated. And we will literally, I could tell you a million stories just of in the year that I've been here, the things that we will do to brainstorm to try to pick them up out of the worst place that they are in right at the moment of time. We do have a food pantry that is inside this building. And I will say that a few times I have had to tap into that resource for a family that is a patient of ours, but is not a student in the building. And there were no questions asked. I left with a sack full of groceries and was able to feed a family whose husband had just passed away. They lost everything. They had no working electricity, and they didn't have transportation. And it wasn't until the very end of their visit that we were able to discover that was what was going on. And so Operation Breakthrough very generously donated, a grocery bag full of food so they could feed their family and their kids for the rest of the week. And just to see the thank you through her response and her obviously like the weight that was lifted off of her shoulders. We even got her transportation home. That to me is a thank you enough. If we don't hear the words thank you, we don't get the cards written in the mail. Just knowing that we are removing some major roadblocks out of these families' lives to get them some help that they need, whether it's food, social services, transportation, medical access, therapy. I don't know how many times I've seen Dr. Halleck in the waiting room or in the exam room for an extended amount of time, talking with a family who is just going through it. And so that's been that's the part of the impact that this clinic and this organization has altogether that you can't measure on paper. But that's the true impact of the work that's being done here on the staff at Operation Breakthrough, the clinic that is in this building every single day.
Wow.
Well, and I know that another thing in terms of that relationships and trust, it's built outside the clinic as well as inside of the clinic.
Mhm.
So Dr. Halleck actually comes to Hair Club when she doesn't have patients on Wednesdays. We have word on the street on Mondays where the advocate team is in the lobby and she's out there with them. So people are knowing her as an individual as well as Rachel and the team. I mean, just things like flu clinics and other kinds of things that happen in the broader space. I think they bring the clinic so that it feels like it's just part of what you do.
Mhm.
And so I think some of the thank yous are the fact that we're seeing more families show up and more families willing to share things that are personal and you won't do unless you trust that you can share those with an objectivity that's going to come with them, because a lot of our families also are very leery of med- of of
Mhm.
of
Mhm.
health, and they're
Mhm.
leery of our court systems, other things. So sometimes they're going to hide things as opposed to sharing them because
Mhm.
they might be misinterpreted. And so I
Mhm.
do think that the clinic helps break that barrier because people feel like they're going to have the opportunity to share things.
Mhm. Yeah, I would say for our families for whom this system was not made for them, and their experience of the healthcare system has been more of taking away than giving. My favorite part is I get a lot more requests on my walk from the parking lot into the clinic and from my walk out of the clinic into the parking lot of an appointment for their child, and they're just so happy. I get a lot of like, "Hallelujah, thank God, thank you so much," because they don't have time to take off work to call to make an appointment. The phone system is really tricky. There's a lot of systems that we've learned to navigate that is just with everything else our families have to navigate is too much. And so to be able to um, help them navigate the system and change the system in their favor for families that are typically excluded for systems has been really amazing. And it's because we've been able to watch Operation Breakthrough's model of doing that, we're able to do that with health too. But lots of families who are just so thankful that they can get healthcare at the place that they also get early education and social services.
Thank you. This is very powerful, everything you guys are saying. And I guess to end on my end, and then I'll open it up for questions for everyone else. What is your hope? What is your goal? What is your dream to really help our community to reach zero health disparities with not only our youth, but our families? As you guys are already doing the work at Operation Breakthrough in partnerships, what is really your hope and dream moving forward?
Oh, that's easy for me. Is I
Yeah.
would love to see the same thing that we're doing for children for their parents.
Yes.
You know, I don't know the exact stat right now, but pre expansion for Medicaid, most people didn't realize that almost no adults qualified. The threshold was so low. I mean, if you made more than 3,400 and some change per year, you didn't qualify. So how do we create that culture of health for parents? So the same things we're seeing for children, that open access for preventative care as well as treatment, and it's embraced by our whole families, would just be amazing. I mean, unfortunately, here we can only do children,
Yeah.
the clinic's set up for children, but imagine a space in which we could do all that thing for the whole family. It would be pretty powerful, especially as it relates to kind of that early care and education center, because parents come in and out every single day. So you've got this audience that's right there.
Yes. Right.
Mine's pretty easy too. 80% of health is outside of the healthcare system. So I would love to tackle the other 80% and really have our community advocate for more resources for families, better paying wages, easier free transportation, access to food, all the things that we screen for. And Operation Breakthrough has done a great job addressing. I would just love to get to the root cause of all those things and then just take those away. That would be my magic wand. My
Yes.
magic wand. Quite have unlimited amount of money. Just take away those barriers, because every child and family deserves to be healthy, and there are more barriers for our families than there are for others. So level the playing ground.
Rachel, did you have anything?
There you go. My mute button wasn't working. I think growth would be something that I feel like that's a tangible thing. I would love for us to be able to grow, and not just within this operation, but even nationally. I think the concept of having access to all the things that the kids and families have access here is so unique that I think it would be great to see that this go nationwide, that other not just daycare centers, but school centers can expand the resources and capabilities to provide access to the underserved communities, because it's not just in Kansas City, it's all over.
Yes. Thank you, ladies. I'm now just gonna go ahead and open for any questions for them. And you can type in the chat box. I think chat box been going already. So Miss Gigi just said, grateful for Operation Breakthrough in our community. My daughter started there in 1982 when they first moved to the 31st Truth location. I have watched the growth over the years, proud of the staff and opportunities for our children through your program. So thank you, Miss Gigi. So yeah, I'm gonna go ahead and you can just unmute yourself and just go ahead and ask that question.
So Mary, how's it going?
Great.
I'm Jermaine Albert here with Live and Well Communities, and Rachel and Dr. Holly, thank you for joining us. What I want to know is, how can the community support Operation Breakthrough? What can we do to provide support to you all? Is it donations? What can we do to support this work and keep it going?
Mm-hmm. I love that you asked that, because it's really a combination of three things: time, treasure, and talent. There's always a gap between what quality care costs and the ability to integrate healthcare into the education space. So that's great. But also, when we were talking about all those other things, the donation side can be really, really important. For whatever reason, this is the first year in this that our data has shown. We do a foundational survey that kind of shows where are we, kind of what's our foundation each year. And this year, food security dropped significantly, and that was the first time we've really seen that much of a drop. And I know part of it is we're seeing some of those public supports that people have seen over the last few years disappear, but I can see it in our pantry usage. It used to be on average people, our families would use it maybe 3 times a month. Now we're seeing them using it maybe 3 times a week. And so just that awareness, people think of food when it's cold. They often don't think of it in the other parts of the year. But I think that's another way where we can support families, because we know health also stems from having access to healthy food. So I think that's important. I think the other thing would be just time. I think the other aspects of health are having relationships, positive relationships, and so getting involved can be really important, whether it's with us or with Children's Mercy or somewhere else. But one of the things we hear most is that mentoring aspect of you know, when they've had someone who's a positive mentor as they're growing up. We do a bus tour that Sister Berta started about, oh goodness, it's almost 20 years, called The City You Never See. And I think that's another way you can get involved, is because what's special about that tour is it's about the resilience that it takes to raise a family in poverty. And so families, parents actually get on the bus, different parts of the east side. So it is about what you see and don't see in terms of physical, you know, supports. But then they talk about what that looks like when you don't have transportation, or what that looks like, the journey from homelessness. Sometimes people think homelessness is just I'm housed or I'm unhoused, but it's a much longer process. And they talk about domestic violence and recovery from addiction, loss of your children, and regaining your children. But you start to get a picture, no matter what field you're in, of how navigating all of those challenges can impact children. So I always say that's another way to just create your own awareness, because you get to really hear from the voice of parents. So, and then the last one, I'm kind of giving you my end of the bus tour, but I always say personally, professionally, and civically. And civically is just be aware of what's going on out there, because sometimes we don't really dig through what some of the legislation or other things going on, and oftentimes those impact health and education directly. I always bring up the spinach scare that was here. I think now it's been about 10 years ago. I don't know if anyone remembers it, but the number one donated product at that point was canned spinach to Operation Breakthrough. And that wasn't even what the recall was on. It was on fresh spinach. But I say that because over the last few years, there's been these, and when they were building the federal budget, they were saying, you know what, we could actually cut benefits, food benefits, and we could just send out boxes of food instead of giving choice and giving SNAP benefits. And I was like appalled, because I knew what was probably going to be in the boxes. So those are the kinds of things, like from a civic standpoint, is dig deep and understand how that impacts some of our more vulnerable children and families. Sorry, too long of an answer, but
That
lots of
was not too long of an answer. Thank you so much. And all I want to know from you is, how do we do that? Is it a website, email?
Yep, we have an easy website. It's just operationbreakthrough.org, and there's a great button on it that says, "How can you help?" And so there's those direct kinds of supports, the family, you know, the pantry wish list, from ways you can support other things. So anyway, but yeah, thank you for asking that question, because I do know that that gap is really important. Like for us, 54%, you know, roughly of the budget, it comes from government sources. The rest we raise, and you know how important those early years are in terms of building those protective factors that will sustain kids long term.
Great. Thank you so much.
Thanks.
Any other questions?
Thank you, Gigi. I am going to find you.
I'll ask a question. I think it's a question, or maybe it's a comment. I don't know. Maybe there's a question in here. I appreciated some of the comments that you made, just about like, you know, really listening to people and building their relationships. And I've worked in, I'm Andrea, by the way. I work at University Health. I'm housed in behavioral health, and I work in the Center for Trauma Informed Innovation. And I've worked in behavioral health for 20 years. And, you know, in doing that work, especially, I worked in the state hospital system for a long time. And it just have seen, you know, parents who have been, you know, they've had their kids taken away, and they've had to fight to get them back, you know, a lot of times because they have been struggling with their mental health. And a lot of times they've struggled with their mental health because they've been living in poverty, because they've been dealing with these ongoing stressors. And then, you know, the system just continues to work against them again and again. And so I appreciated that you know, you talked about the need to just continue to like really listen, and then to not just fall back to the system the way it was built, right? And to change the system and to make things work for the people, rather than to make things work for the system. And so I think my question then is, when those like mental health needs arise, how are you partnering with other like mental health providers outside of what you already do within your system to get people the services they need, maybe without kind of adding on those layers of additional trauma that come with, you know, kids being removed from their houses and their families and those kinds of things that come with that.
Mm-hmm. So I'll jump in first. You know, obviously we have the healthcare team here, and we're also watching behavioral health change in terms of what's happening in private practice versus, you know, in community based. And so we're also trying to shift the model so that we're kind of working through we have this pyramid of supports where sometimes we're just working socially, emotionally, other times we're looking at significant trauma that we're having to look at. I know LaShonda Milner's on the call, who hosted for some of our kids a grief camp recently with another entity, which was really critical when you look at the number of our kids that lose family members to homicide and other causes. So reaching out and partnering with other agencies for specific needs has been really helpful. Obviously, we work very closely with Children's Mercy and some of the other referrals. There's obviously a huge backlog in the ability to refer. So that's why we constantly are looking at, you know, where do we need consultative support from our clinicians, and where do we need direct treatment and one-on-one, and where do we need small groups. So we're always kind of assessing what that landscape looks like in terms of kind of getting as much support as we can, and then also the ability to connect what is happening from a behavioral health standpoint with children with what's happening in the broader family. So we're always kind of closing that link. So it's not children are here, families are here, but how do we bridge that back?
And I'll say on the clinical side, I have nice algorithms that are coded. We've worked with our Partnership for Resilient Families. This was one of our projects, was how to figure out how to get kids the behavioral health services that they need. Depending if they're a child at Operation Breakthrough, they sometimes can get their services from Operation Breakthrough, but we also have social work from Children's Mercy that can help some of the services they have there. They offer trauma-informed cognitive behavioral therapy, as well as parent-child interactive therapy. And we also have relationships within the community. Our social workers can help us find which places within the community have resources that can match the needs that they have. And so really it's just talking through everybody and all the resources we have here to see what's the best match before we go to the family, so that they don't have to do it. They already don't have time to do it. They've been in crisis for 6 months by the time they've come to me. And so doing a lot of the case coordination, that's a big piece of what I do here outside of my clinic time, is just getting the plans that were supposed to be sent to the families, but didn't actually make it to the families. A lot of the care coordination and helping the families navigate that so that they don't have to.
The other thing I think that's really important is, like with the Children's Services Fund, you know, now they removed the sunset clause, so that's in perpetuity. But that's really where probably the core resources in the community right now are, in terms of some of the behavioral health supports to be able to do more prevention as well as treatment. So for us, like in those infant toddler years where we're really trying to focus on attachment, we have a pretty strong music therapy program that works on that. And then we have yoga for all of our preschoolers, have yoga to really work on building self-regulation skills. And then we have a music movement that transitions kids into those services. I absolutely love the program that's working with our school age right now, which is more of a preventative program called Sparks, which helps kids to really navigate those coping skills and to really work through a lot that's happening kind of in those adolescent years. So I think that the focus on prevention as well as treatment, there has to be a balance to those. And I think we continue to work on how do we make sure we do that.
I was just going to add to, this is LaShonda Milner,
Okay.
one of the youth and family therapists here at Operation Breakthrough. I was going to mention Sparks and the preventative nature with stress management that trickles over from not only the kids, but to the parents. I think adding the resources for maintenance as kids leave the center and are at home in those stressful environments, being able to have some tools that the parents, some handouts, things like that, follow up with the parents to help them to really help their kids outside of Operation Breakthrough has really been a huge success as kids have come back and shared, how they're feeling, the stress in their bodies, and they're able to verbalize it and put a name to those emotions, and then how they're coping with them in new and creative ways. So I think it's really been great to see, like you said, not just in the classroom, but it's trickling over to the entire family and hopefully to the community as well. It's really been beautiful to experience personally, but then to just see also there at the center.
And I was going to say, I'm glad you have music therapy too. I'm a music therapist also.
Yeah. Oh, yay.
I was going to say, and you said yoga, I'm a yoga instructor. So I actually do kids yoga for a link program. So, and I absolutely love it. Like, first of all, it's hard for kids to be still. So to teach them how to be still and to see it is like a game changer once they learn it and can use that to just help them navigate their, behavior and control it. It's amazing. So, and I'm sitting here thinking, like, how can I sign up to be a kid at Operation Breakthrough? Because you guys are doing some amazing work. Like, from the bottom of my heart, it's just like I want to tear up because I know as a single mom myself, how hard it is to really just the healthcare side to call, make an appointment, take your kids to their doctor's appointment, And so I truly just want to thank you all for being on this call. And I didn't know if anyone else had any questions or comments. But yes, I thank you all for being on this call. Dr. Mary, Rachel, everyone at Operation Breakthrough, you all are doing an amazing job and continue to do the hard work. And I know it's not easy day to day, but I know families and the kids just love. When I was there, I think about a couple months ago, because I worked with Donna. She was part of our interview process for our visual promotion. And when I went in, I could just see the kids like pulling their parents to get in there really fast. And the parents are like, all right, bye. And they're like just walking off, not saying bye to their parents. So you guys have created such a safe space for those kids. And when I walked around, I can just see the smiles. I can hear the laughter. I can feel the love. I can just see just the passion from the teachers. And so continue to do amazing work. And again, thank you for being on this call and having that partnership with Children's Mercy Hospital. And I thank you. I can keep saying thank you the rest of the day. So any last comments you guys want to say?
I just want to thank you for just hosting this topic because I think it's so critical to that healthy start in life and kind of long-term culture of health. And if anyone on the call would like to come visit, we would love to host you. It's kind of seeing it in person can kind of really cement it.
Yes.
There's a few things as we wrap up. I want to thank Danielle for moderating such a great discussion today, and thank everyone for Operation Breakthrough. I want to encourage you to visit our website for any webinars that you've missed in the past. I just put that link in the chat feed. So please feel free to visit our website for any webinars that you may have missed in the past. We will have this webinar or this learning community, if you would, placed on the website soon. So you can come back and hear this and share with others. We also want to encourage you that if you have a topic that you would like for us to cover in 2024, to please send an email to Danielle, and Danielle will place her email address in the chat feed, because we really love highlighting all the great things that are going on in Kansas City. You all make me proud to be a Kansas Citian. And so we want to hear from you all that are on this meeting with us today, what topics you would like to hear. If you yourself want to be a presenter, let us know that too. And we want to create this list for 2024, because who would have thought we are almost in November?
I know.
So we most definitely would love to hear from you all. And thank you all for attending this learning community event.
And yes, thank you again. I will be sending out an email just to follow up with you all. We have an evaluation, and I'll also attach the link of this recording so you can share with your team members or any peers or family friends. And I also will be sending just updates as we have exciting things going on with our merger organization and some innovation hubs and ambassador opportunities. So Mary, thank you again. Ning, Rachel, thank you again. And I'm going to give you guys 9 minutes back of your time. And so enjoy it. Have a great weekend. Hopefully this rain will stop, hopefully by the weekend, but thank you all. So
Thank you for letting us join in and share our passion. It's been great.
you're welcome.
Thank you.
Thank
Bye,
you.
everyone.
Bye.
Bye.